Hi everyone, my name's Priya.
And my name's Anna, and today we're doing another video in our Outspoken series. Today we're speaking with Dr. Harris, a professor of sociology and criminology at the University of Arkansas, about the ways in which COVID-19 has affected different demographics.
Well, thank you, Dr. Harris, for joining us. Starting off, would you mind telling us a little bit about yourself?
Sure. I'm Dr. Casey Harris. I am the Center for Social Science Research Director at the University of Arkansas, and I'm the current graduate coordinator as well. I did my undergraduate degree at Texas A&M University, started off as an aerospace engineer, and then transitioned to sociology. I did my graduate work and my PhD at Penn State University and graduated in 2010. And have since been at the University of Arkansas. Most of my research focuses on criminology, demography, and kind of the intersection of social stratification and crime in particular, kind of a quantitative methodologist as well.
So what are your primary research interests, and what have you researched in the past?
So my primary research interests kind of intersect around race, ethnicity, immigration, and crime in particular, kind of at the community level, right? So thinking about how the changes that are brought on by immigrants moving into and out of different places affects patterns of victimization, offending, arrest, and the responses to that, including kind of the mechanisms, family structure, things like education, language, that change the way that crime moves and operates around different immigrant types of communities. More recently, I've been working with Priya, as a matter of fact, on some stuff related to the COVID-19 pandemic and the sort of social response to that. So that's one of my National Science Foundation grants that I'm on right now. That work primarily focuses on fear and the responses to fear. So how do people feel early on in the pandemic? So around like the early March period of time, and their responses to that sort of early stages of the spread of the virus, and the social responses to that, sort of the differences across groups and their reactions, and then the implications of those things. And then I have like sort of a separate area of research that focuses on kind of emerging adulthood and the transition from adolescence into young adulthood around the college experience. So I actually wrote a book that just came out in February out of Oxford Press called The Science of College, Navigating the First Year and Beyond, which is sort of related to all of those kinds of intersections. So yeah, that's kind of generally my research area.
You talked about the research that you've been working on with the National Science Foundation. Could you describe how you analyzed and broke down that information from that survey?
Sure, yeah. So this is one of the things that we realized early on is that, in fact, the project actually started out of a conversation in the hallway with my colleagues over kind of coffee. We were lamenting the fact that nobody could find household goods anywhere in town, and people had sort of responded with panic. And so one of the things that we were particularly interested in at that period of time, being social scientists, is not the individual necessarily reaction, but how it changes systematically depending on which group you sort of belong to, and how you viewed the unfolding of the virus's spread early on. And we had some ideas specifically related to distance. So like how people respond relative to how close the virus is. Because remember back in March, especially like early mid-March, it was primarily located in New York City, or relatively low levels, and then of course the Pacific Northwest. And so we were particularly interested in how people responded early on to this idea of the virus kind of coming into other areas of the country, and how that response would probably play out over the subsequent months. So we actually engaged what's called a rapid proposal, which is an NSF mechanism for funding research really quickly. And so we were able to go from an idea over coffee in the hallway to fully complete data for 10,300 people across the United States in the matter of about 3.5 weeks, which involved a lot of late nights and a lot of phone calls between people, because we were of course not allowed to be on campus and everything had become closed down. But our primary focus was on that kind of fear response, things like panic buying, concern towards the elderly, those who are immune compromised, those who already have existing kind of physical or health deformity, disabilities, those who are particularly concerned, in terms of their mental health outcomes, things like suicide. We have a paper published on the COVID-19 pandemic and suicide, anxiety and depression, sort of the general responses that kind of come out of something that is kind of unprecedented, but is very similar in other ways to other public health crises like hurricanes, other viral outbreaks, so like H1N1 or the Ebola crisis in particular, although they're on much smaller scale, those kinds of things. That's kind of where this project came out of.
What have you found regarding mental health during the pandemic?
So interestingly, first of all, mental health does seem to have deteriorated kind of as a populace during this period of time, at least in our data. And so our data is nationally weighted. So we're trying to speak to sort of the overall prevalence in the United States population to some degree. And we do find, for example, like depression levels are significantly higher than we would normally expect. Anxiety, not as much. But one of the bigger findings is, in fact, that like specific fear of COVID-19 does, in fact, link to higher levels of depression. So, and it's complicated because that fear is not necessarily about illness itself. It's fear of, the sort of the economic repercussions for one's family, or the effect for children, or maybe if you have loved ones who are elderly. And that fear is really complicated, right? Like fear is not something that we think of as being if somebody said, what are you fearful of and how do you know? That's something that's kind of difficult to measure. And so we do know, for example, that the mental health consequences of the coronavirus pandemic are complicated and there's a lot of nuance to them. And that fear doesn't necessarily translate to depression for everyone, but particularly for those who are socially vulnerable, right? Those who are already sort of at a disadvantage in the hierarchy of social status here in the United States in particular.
How has the mental health crisis affected specific demographics differently?
Right. So, we find in our own data, for example, that those who have children, those who are female, those who are in racial ethnic minority groups, some, not all, but some racial ethnic minority groups tend to have lower or higher levels of depression, higher levels of anxiety as a result of the COVID-19 pandemic specific fear. And again, like we don't necessarily have data to say why that's the case, whether it's economic or it's illness related. Some of the evidence tends to suggest it is illness related, that they're, especially, for example, mothers with children are particularly fearful of their children getting sick. Versus, I'll be honest, like fathers in our data don't seem to have the same level of fear. And those things tend to translate very differently for those groups, right? So that we find very acute levels of mental health crisis for those who are already vulnerable. That fear has sort of compounded that vulnerability in a lot of ways. And that translates, of course, to poorer mental health outcomes.
Have you noticed any patterns in relation to where people get their information from?
Yes. In fact, we have a paper under review right now that I led. I shouldn't say that we know specific sources, but we know that the extent to which people get their information and that information presents some sides of the COVID-19 pandemic does in fact relate to concern more generally, right? Or fear of the virus, or even their mental health outcomes. And this is, it's a really complicated story, right? I always tell my students that in sociology, our buzzword is it's complicated, right? Like that's our catchphrase, because we have people are messy. And in this case, how people consume information, especially early on about the virus, because remember early on in like sort of the late February, early March period of time, there was a lot of disparity about the way that we talked about what the virus was going to actually look like. So today we sort of, and I mean, it seems like ages ago, honestly, because we're all living without time, it seems like. But, back today, we sort of think of it as everybody understands the scope of death and, the viral spread, like it's touched every community. We don't have a county in the United States without the virus present, at least to some degree. Back when our respondents were answering about this stuff, there was a lot of disparity. There were a lot of places that felt very removed from the pandemic as it was unfolding. And what we found in our data is that when individuals consumed more information from different kinds of sources, they had higher levels of concern, right? That their perceived threat of the virus was higher. And it also, there were really prominent disparities early on between, for example, like political affiliates. So a political party ideologies. So for example, Democrats tend to have about 10%, 15% higher levels of fear than independents and Republicans. And a lot of that effect, by my estimation and my analysis, about 50 to 60% of that difference is accounted for by media exposure. Like if their media talked about the virus and its sort of severity, its scope, then those individuals were much more likely to see it as a problem than those whose media did not talk about those things in those ways, right? So in other words, like political disparities, even gender disparities to some degree, and racial and ethnic disparities are to some degree, not entirely, but to some degree accounted for by how people are consuming information about the pandemic and the level of concern that information sort of passes on to them.
How does that fear impact the actions of people, especially when looking at mitigation strategies?
Yeah, and that's a really interesting one. So our data, and in fact, we've talked a little bit about doing some analysis on this, and the pattern is pretty consistent in our own analysis as it is in others that we've done with other colleagues here at the university, which is to say, fear does in fact affect the way that people perceive the actions they need to take to prevent the spread of the virus, which doesn't come as a shock. Today we're still having the debate about, what it means to wear a mask or, in different cases get tested if or quarantine or avoid schools or, healthcare organizations and those kinds of places. Early on, we in our data, for example, in late March, it's pretty clear that those who are more fearful are more likely to adopt personal mitigation strategies. So in this case, things like washing your hands, avoiding public transportation, wearing a mask, shopping out less or ordering food in more, those kinds of things that they might do to subsequently prevent personally the virus from infecting their family or immediate social circles. And that's also true, by the way, of public health strategies in terms of their support for those things. People are more likely to support, for example, the closure of schools and churches if they feel that the virus is a significant threat, which of course makes sense, but it's also conditioned by other things, personal ideologies in particular, that probably also matter quite a bit. So for example, just because someone is fearful doesn't necessarily mean that they will always support those kinds of personal mitigation strategies. They tend to be more pronounced amongst, for example, females. Females who are fearful are much more likely to take action than are males in our data. And so those kinds of things are kind of part of the complicated story, at least early on, that we're trying to tell with this, because what happened early on, of course, affected subsequently how the virus unfolds later on. So we sort of have a very unique period of time in our data to capture sort of the early stages when we knew the virus was coming and it was spreading, but before people had universally been oversaturated with concern for it. So that is, in fact, part of the story, is this difference in terms of how people viewed personal mitigation or public health.
So how has the national response to COVID-19 in recent months affected the level of fear nationally?
So our data don't necessarily speak to that. I will point out that, like, for example, there's the Kaiser Family Foundation. I think Gallup has one, Pew has one, a kind of a tracking poll on overall levels of fear. And that has waxed and waned for some groups more than others during this period of time, that largely, not perfectly, but largely tracks with sort of the initial surge, of course, into New York, and then subsequently it's declined nationally in terms of death rate, and then the subsequent kind of I wouldn't even say second wave, of course, because most epidemiologists still believe we're knee deep in the first wave, but subsequently the sort of rise then again in recent month or more in terms of cases, right? So people are in fact significantly concerned still about the virus, though again it does vary depending on who you talk to. But for example, I was reading that, there's a lot of the polling evidence even still today shows, especially as the school year comes closer in time, that students might be starting back up, people with children are particularly concerned about what that means. Because, early on, our understanding of vulnerability from an epidemiological standpoint was somewhat underdeveloped. So there was a lot of conversation about whether children were in fact even susceptible really at all. And now we know, in fact, that they are major transmission vectors. If they're not personally responsible for high levels of death, they are still substantially responsible for the actual passing on of the virus itself. And so, a lot of that concern is coming back again for a lot of people, I think. And that's being borne out in a number of different sort of micro polls across different snapshots in time, or, even national tracking polls kind of on a week-to-week basis.
And this is a bit of an opinion-based question, just kind of theoretically thinking about if you were to send out another survey now, how do you expect those results to differ? And would you be looking at different main themes in your research findings?
Yeah, I think we would still look at a lot of the same themes. I think, we still are, I was literally running an analysis this morning on doing some like kind of spatial modeling and like thinking about like case proximity and things like that. There's a lot of information that we still really don't know how to kind of tell the story on. And that means, that if we were going to pursue sort of a second survey, I think that we would still follow the same sorts of substantive themes and thinking about like fear, mental health, family, mitigation, kind of just the general framework in which people navigate the uncertainty, both sort of from a health standpoint, as well as from sort of an economic and family structure standpoint, the unfolding of the pandemic itself, because it's still very much going to go on for a while. I don't think anybody expects, well, let me back up. I don't think anybody who is rooted in epidemiology expects that this is going to go away anytime soon. And that there are, in fact, a lot of unknowns about what's going to happen when students enter college campuses or into public school systems. And so I think if we were to design a second survey, we would want to tap into that uncertainty to maybe focus in on some specific time-sensitive questions relative to those things, right? So asking about, fear in the context of fear towards their children. Are you fearful of your children getting sick themselves? Are you fearful of sort of the overwhelming of the community health structures? Are you fearful of those children carrying the virus to somebody who is vulnerable, like truly vulnerable? And that fear is really still unfolding, as well as the sort of economic aspects of it too, right? So we're coming up on an eviction crisis. If you haven't read the work of like Patrick Sharkey and others, I mean, they literally are demographers talking about the pending, foreclosure or eviction crisis. And there's literally a book called Evicted that kind of talks about this and the vulnerability of housing. So are people, really kind of looking at the horizon, in the next like couple of days here, the unemployment support is going to is going to be fully done. We still haven't negotiated what that's going to look like moving forward in terms of levels of support. Are people fearful about not the virus itself, but the fallout of the pandemic on their personal lives from a very economic structural perspective? And that's something that our data did in fact touch a little bit on. And we did find that especially, in late March, when people are starting to see unemployment levels rise, especially for more vulnerable workers that were kind of underemployed anyway, especially in the service sector, they were already fearful then of those consequences. And now we're seeing sort of the lag in rehiring, and then subsequently, what happens if there's another shutdown, and then not to mention the sort of housing crisis that follows that. I think those are all really important themes that we would want to follow up on.
What reasons are contributing to COVID-19 disproportionately infecting certain groups of people?
So, I mean, I'm not really an epidemiologist in the sense that I can speak to the physical parts of those things. I can only speak from our data, like as a scientist. And so I will say that like levels of fear, for example, early on amongst some of the groups that have been especially hard hit were not as pronounced as you would have thought, given what we know now about what the impact has been on those communities, right? So, I will say, for example, some of the more fearful groups in our data are those that are higher income earners, for example, or those that are white. African Americans in particular were somewhat lower than every other group in terms of their overall levels of fear. And this is borne out by some of the infographics that I know Priya has been working with us on. And it was sort of kind of surprising to us, given that when we were putting these things together, of course, like a month or so afterwards, we knew that some of these communities had been especially hard hit. And there are some, there's a lot of really smart people in other areas that have talked about things like comorbidities that put them at especially high risk from a physical perspective, or the fact that a lot of these groups work not essential jobs, and so their exposure levels are higher. And so they've been just, sheer number of hours or number of points of contact of exposure are higher because of the things that are statuses that tend to be kind of co-associated with those groups. And so as a result of that, I think a lot of those communities are also underserved by healthcare institutions. So in fact, the analysis that I was running this morning looks at some of the healthcare data that we have in the United States and maps onto our fear outcomes, kind of the contextual effects of healthcare vulnerability. So like we can actually classify different counties as being kind of lower in terms of levels of like healthcare access, right? Or healthcare sustainability or overall resourcing. And in fact, that is strongly related to levels of fear, right? So more vulnerable communities tend to report higher levels of fear, even if the individuals themselves living within them, don't personally feel like they're at risk. As a group, they tend to see their vulnerability from a kind of a contextual or milieu perspective now in ways that they may not have early on, right? And so there's social factors, there are biological and epidemiological factors, there are healthcare factors that are all sort of kind of mingling together to put certain groups more at risk than others. And I think that we've seen that kind of play out. Some people have been good at kind of articulating that. Others have not been, and they kind of tend to focus on one aspect of it. Like many things in sociology, I don't think there's one aspect that tells the whole story here. It's a complicated mix of kind of historic vulnerabilities, community effects, individual effects, and that goes for both social effects at both levels, as well as biological and epidemiological and structural effects.
So I know you've already kind of touched on some of the papers that have come out of your research, but were there any other sociological findings and research that have come from this study specifically?
Yeah, we've done some really interesting things lately related to trust. So one of the things that my colleague, Dr. Drave, has been working on is, and I've been kind of helping with some of the data analysis on this, is related to how we view other institutions of our community as a result of the pandemic, right? And so one of the things that we talked about early on was whether or not we wanted to actually ask our individual respondents about how they view their local government, their police, the national government, and the kind of response to this. And we ended up collaborating on the survey design with a bunch of people in Canada, the UK, and Germany as part of a kind of a national COVID response survey group. And they really encouraged us to, I think, conclude those things. And I'm really glad that we did, because some of the more interesting things that we found is that people's levels of trust as a result of this fear have shifted in really interesting ways. And it makes sense if you sort of think about it as a sociologist, or especially as a criminologist, because one of the more interesting ones is that fear actually translates to higher levels of trust with the police. And early on, one of my colleagues, Dr. Fitzpatrick, who's the primary researcher on this, primary investigator, he was like, well, why would that be? And I said, well, we are all stuck at home. We feel kind of empathy, I think, to some degree with people who are having to work during this crisis, essential workers, police being one of those. And in fact, in a lot of ways, we're leveraging police organizations to a larger degree than we ever have before, because the sorts of informal controls that we used to have in our neighborhood, namely through our neighbors, we're not really able to do anymore. And so the way that we view different groups and different organizations within our society shifts during a time when we're all locked down and we're, all kind of staying at home and having to kind of think about those institutions in different ways. And so our own data, we found, for example, that fear actually decreased levels of trust in our neighbors. And a lot of that comes back to, I think a lot of people were expressing frustration or a lack of trust in their neighbors being able to mitigate personally their own risks. Like the stereotypical, I can't trust them to wear a mask, right? But in other ways, other institutions benefited from that level of fear, like the police, for example. And that was a very interesting sort of trade-off, because the opposite, of course, is true during other periods of time. If you ask individuals more generally, who do you trust more? Some groups will always rate the police higher. But it's interesting to see how fear sort of creates different trajectories for those groups. And that's a very interesting kind of sort of sociological phenomenon. The other sort of interesting side of those things is I would mention the work that Priya suggested, that we kind of look at these intersectionalities. And, there's some very interesting things going on regarding the vulnerabilities of specific intersectional status groups. And what I mean by that, Anna, in case you're not aware of what we're talking about here, is this idea that, it's not just females being more fearful than males, or it's not just individuals with children being more fearful than males. Or, for example, we find those who are, single tend to have higher levels of fear. And there's a lot of individual reasons for any one of those things by themselves to explain why that makes sense, right? So, and for example, single individuals might have more fear because they don't have the social support of somebody to sort of back them up. But, or for females, that they already are kind of at higher, they're more empathetic and risk aware for individuals outside of their immediate social networks than men tend to be. And that's borne out by social psychological research. But it's the intersections of those things that's really interesting. Because, for example, in our data, it's really single mothers that bear the brunt of that level of fear, and therefore take really seriously how to mitigate that, or their support for public policy initiatives to really be restrictive towards the spread of coronavirus. You would think that men and women who have children would share that equally, or single dads versus single moms, they would look similar. But the answer is the data doesn't really actually show that at all. It shows this very dramatic disparity between these sort of different groups of individuals. It's not, for example, women as a whole. It's not even people with children as a whole. It's really just specific groups that bear that burden, in terms of their internalization of that fear, and then the manifestation in social behavior. And that's a uniquely sort of social science perspective, as anybody who's taken a social science class will tell you, like the intersections of race, class, gender, family structure. That's not something that very many disciplines kind of take to heart the same way that social science does. And that's been a really interesting story to tell.
Going off of that, in what ways do sociology and criminology intersect?
Well, I mean, criminology is sociology, where our dependent variable is crime, right? So on my degree, my PhD is in sociology. It is not in criminal justice or criminology per se. Just like, if we were to have a sociologist of education, their outcome, their interest areas, educational types of things. It might be educational attainment, it might be test scores, whatever. In criminology, it's much the same way. So I study the sort of social phenomena that underlie the disparities across groups in terms of their exposure to crime, whether they're offenders or they're victims, or the criminal justice system's impact on those places. So criminology is inherently a sociological pursuit. Most of our discipline is filled by sociologists who just happen to study crime, as a matter of fact. So I teach my graduate students, that's like our first day in theory class as a graduate student, is to go over, look, we're talking about Marx, Weber, and Durkheim. We're talking about, Simmel. We're talking about Bourdieu. It is essential sociology. We're just going to be applying it to crime.
Awesome. And wrapping up with one last question.
Sure.
Do you have any advice for any students out there who might be interested in getting involved with sociology or criminology?
I mean, I would say get involved with research as early as possible. It's one of those things, I think, in our discipline, and this is something I've written about even in books, is that, it's hard, it's easy for students who are interested in biology to see like a biologist in a lab, right? They can walk by a college campus and go, there's the biology lab. Social scientists, we work kind of in our computers in the dark to some degree, right? But we do such human-centric work that is inherently interesting to everybody, right? I mean, when's the last time I've never told anybody I'm a criminologist and I study race and crime, and they go, oh, nobody cares about that, right? Or they don't have follow-up questions. And so those who are interested in sociology have to understand that it is a science like anything else. And to really appreciate what that science looks like means getting involved with research early on. And so a lot of our time is spent sort of mentoring students as to how to actually be scientists, rather than thinking of themselves as like philosophers who study people in the current context, right? Like that's not really what we do. We take theory, we work through the scientific method, we collect data, we analyze that data, whether it's quantitative or qualitative, and we systematically observe individuals and draw conclusions about their behavior in that sort of social sense, right? Rather than thinking about them as individuals in a psychological sense, right? Their mental state, and as a psychologist would, or as an economist in terms of their work and output, but in the very much the interaction between other human beings in that context and the organizations with which they're a part of. So, we have sociologists working at all different levels, and you really don't understand that until you get involved in that research to think about, we have sociologists who are demographers that study population in a community sense, just as much as we have individual sociologists studying, veterans in a veteran court, for example, and they're, living with them day in and day out, kind of spending all of their time with these 20 individuals. It's a very different setup. And so the way to get students engaged is to lead them through that process where they can express their own interest and then see what it actually looks like to be a scientist with that interest.
Well, thank you so much, Dr. Harris. I hope you all enjoyed that video. Thank you so much for watching. Check back next week for our 4th video in the speaker series about intersectional feminism.
And if you haven't already, make sure you subscribe down below, give this video a thumbs up, and make sure you turn on the post notifications. To find more of Loud Women, you can check out our website, loudwomencommunity.org, and find us on Instagram at loudwomencommunity. Thank you so much for watching.
See you next time.